My best memories from my childhood are the summer vacation with my parents near the Baltic Sea, and when I was 10 I promised myself to live in the city that is located near the sea. So that's why this is Gdańsk. One of the form of relaxing for me is to go for a long walk, to take away a coffee and to feel the spirit of this city. My story goes back to 2008 when I met for the first time my first mentor, Dr. Agnieszka Woźniak. At the time she was an assistant professor in the Department of Biology and Medical Genetics here at our university, and she was also a lecturer of a molecular genetics course during my studies. I studied laboratory medicine, and I remember that after this course, after this exam, she offered me to join her research team. Immediately I said yes, because I noticed that that's a huge opportunity to me. After that, after my studies, I did the Ph.D. studies under the supervision of Professor Limon. Thanks to them, both of them, I am here where I am. I have two backgrounds, because I'm a researcher, but I'm also a diagnostician. And this project, LEADER project, this is the project that allowed me to combine these two backgrounds. The aim of my project is to implement custom design next generation sequencing technique for molecular analysis of patients with a clinical suspicion of NF1 or related phacomatoses. Neurofibromatosis type 1 is one of the most common genetic disorders, and the pathogenesis of this disorder is related to the pathogenic variants in the gene, which is also called NF1 gene. This is a very large gene, and today even more than 3,000 different pathogenic variants are described in this gene. It's very difficult and challenging to find this particular variant that is present in the patient. There is a type of variants that is called splicing variants and also deep intronic variants that are located very deeply in introns. We need to remember that these patients, these individuals, they have a higher risk of develop tumors. So that's the reason why these patients, they should have as soon as possible the diagnosis made.
The uniqueness of Magda's project is related to the fact that one of the etiologic factors of neurofibromatosis in general is somatic mosaicism, and this aspect of research requires further attention and may lead to development of diagnostic tools in this challenging area of analysis.
It's important also to mention that the genetic disorders they do not affect only a single patient, but also the whole families. They require the genetic counseling, the genetic management, and this is also very important, to receive this test, the result of this genetic test, to give these patients, to give their families the detailed genetic counseling. I had the great opportunity to spend 3 years in the reference center at the University of Alabama in Birmingham in the United States. I joined Professor Ludwine Messiaen's lab. She's a worldwide leader in the NF1 field. She's also present in this project as my mentor.
I could closely observe Magda's scientific development since she became PhD student. Further, I acted a little bit like her mentor, and now I'm just proud that I can collaborate with her as my research partner.